Yes, so at this ASH meeting 2025, we have a poster which is being presented on Monday looking at the incidence of CNS relapse after CAR T-cell therapy in patients who had no previous history of CNS involvement. So we excluded patients with primary CNS lymphoma, with secondary CNS infiltration, even patients who had CNS involvement at diagnosis and had cleared that prior to CAR T-cells. Those patients were also excluded. So definitely excluding all patients with any kind of a history of CNS involvement. And we eventually had a patient population of 1,000 plus patients who had received CAR T-cell therapy, and we observed that the incidence of CNS relapse was indeed very low. Interestingly, we compared this to a chemoimmunotherapy cohort to try and, hypothesize that perhaps as CAR T-cell therapy, CAR T-cells cross the blood-brain barrier, there could be some kind of protective effect from CAR T-cell therapy, even if the patient was relapsing to that treatment, compared to chemoimmunotherapy in the second-line setting with a platinum-based salvage chemoimmunotherapy regimen. However, in this analysis, we observed a similar low risk of CNS relapse, both in the CAR T-cell therapy cohort and the chemoimmunotherapy cohort. I think, definitely it will be very valuable to see, the first-line CAR T-cell trials, the Zuma 12 and the Zuma 23, look at the CNS relapse incidence in these patients, after CAR T-cells, if they relapse, that will definitely shed some additional light on this question. So this will be presented as a poster on Monday, and we're very excited to share this data with everyone.